Hi, welcome to Health Chat. I'm Dr. Alancia Wynn. Today, we're going to be talking about travel. This is my passport. I love to travel, and I'm sure a lot of you love to travel as well. And I'm sure you're wondering, now, why is a health show talking about travel? Well, because when you travel, especially if you're traveling to more underdeveloped parts of the world, you always want to think about ways you can stay healthy as you travel. In fact, of 100,000 people who travel to a developing world for a month, of those 100,000 people, 50,000 travelers will develop some sort of health problem during the course of their trip. 8,000 of those travelers will have to see a physician. 5,000 will be confined to bed. 1,100 travelers will be incapacitated during their work, either abroad or upon returning home. Again, 300 travelers will have to be hospitalized either during their trip or upon their return. 50 travelers will be so ill that they will have to be air evacuated out of the country they are visiting, and one will die. So it always is important to think about the health risk of the country that you're traveling to. Now, what's the most common things that people come down with when they're traveling? Somewhere between 20 to 60% of them will develop traveler's diarrhea. 5 to 20% of people will develop some type of acute respiratory illness like a cold or the flu. About 2% of people who travel to West Africa, if they don't take any medicine for malaria, will come down with malaria. About 0.1% of people will develop an infection spread by mosquitoes called dengue fever. Hepatitis A will be a smaller percentage, and rabies risk from animal bites will be an even smaller percentage, about 0.3% of travelers. So the main thing that you obviously want to think about are the more common things. Now, I always recommend people who are traveling to an underdeveloped part of the world to go see a physician who specializes in travel medicine before they go. And the things you want to talk to that physician about will determine what you're risk for. And the things you want to think about are your itinerary, why you're traveling. Are you traveling for business? Are you going on vacation and going to be staying at a resort where you don't leave the resort? Are you going home to your home country and visiting family and friends? Are you doing mission work? Are you doing a study abroad? What's the reason for your travel? Because that will change your risk. You also want to think about the duration, the season, and the style of your travel. Are you someone who's going to be backpacking through the jungle, staying in hostels or lower end places? Are you someone who's going to be staying at 5-star Western style resorts everywhere? So all that makes a difference. And seasonality also, because different diseases are more prevalent during different parts of the year. You also want to take into account your medical history. You want to take into account any vaccines you've had before, your immunization history, any allergies you have, either allergies to medicine, allergies to food, allergies to vaccines, all those type of allergies. The things that the travel physician will talk to you about will be things like food and water precautions, preventing insect bites, getting your vaccines. Now, when people think about going to see a travel doctor, that's the thing that they really think about are the vaccines, but it's a lot more to it as well. Think about malaria, think about sexually transmitted diseases, medical care in the place where you're going to be, any issues related to air transportation, blood clots, illnesses on planes, things like that, environmental risks both in travel, in transit to the country, and the environment that you're going to be in while you're in that country as well as safety, security, any travelers with special needs, babies, pregnant women, people who have medical issues, and then also the cultural issues based on your culture and the culture that you're going to be visiting. Now, when we talk about vaccines, that, as I said, that's the most common thing that people think about when they're going to go see a doctor for travel. Oh, I need to get my shots for travel. I need to get that taken care of. So there are 3 sets of vaccines that you always want to make sure that you're up to date on. The routine vaccines, both the childhood vaccines if you're talking about a child, adult immunizations that are routine, any required vaccines based on where you're going, and also any recommended vaccines based on your risk of infection depending on your itinerary and what you're going to be doing while you're there. Now, the routine vaccines that we think about: tetanus, whooping cough, some of the ones for children, polio, measles, hepatitis B, influenza, which is true for adults as well as children, influenza type B Haemophilus, which is another vaccine that children would get. So all of those are the routine vaccines that you always want to make sure that you are up to date on anyway, but especially if you're going to be traveling, you want to make sure that you're up to date on all of the routine vaccines. Some of the vaccines that you would think about for specifically for travel: hepatitis A, the human papillomavirus, which is also a routine vaccine, which is Gardasil is one brand name of it. The meningitis vaccines, rotavirus is another vaccine for children, and tick-borne encephalitis is a vaccine that they give in Europe and some other countries, but we don't have that vaccine in this country. Now, the two vaccines that you would think about there are only two vaccines that countries ever require for travel. One is yellow fever and one is the meningitis vaccine. Yellow fever vaccine is required for by certain countries based on either they are not infected with yellow fever and they want to stay non-infected with yellow fever, so they require people coming to the country who are at risk for bringing yellow fever into their country get the vaccine, or they are infected with yellow fever and so they want to make sure that all their population is protected as well as anybody coming in is protected. Meningitis vaccine, the only time that is required is for people who are going to Saudi Arabia for the religious pilgrimage every year. Because it's such a crowded environment, they require that. Now, these maps are the maps of where yellow fever is in the world. And you can see primarily it's in the vast majority of the jungle area of South America, as well as the more jungle area of Africa as well. Those are the countries that are infected with yellow fever. So if you're going to one of those countries, that's when you would want to think about getting a yellow fever vaccine. Now, hepatitis A is another common vaccine that you want to be sure that you would get. Going back to yellow fever for 1 second, you do want to make sure that if you get a yellow fever vaccine that you have it at least 2 weeks before you leave, and that you go to a medical provider that is authorized to give that vaccine, and they will give you what's called a yellow card, which is the proof of that you've gotten the yellow fever vaccine. And that's what you would need to show at the border if you're going to a country that requires the yellow fever vaccine, because you will need to show that proof before they let you into the country. Because if you try to go to a country that requires yellow fever vaccine and you have not had the vaccine, either they will not let you go into the country, they will quarantine you at the border for a certain amount of time, somewhere between 10 days and 21 days, or they will require you to get the vaccine at the airport, which is none of which are ideal situations, obviously. So you want to make sure if you're going to somewhere in that area on that map I showed you earlier, that you get that vaccine done before you leave so you don't run into any of those situations. Now, hepatitis A is a disease that is spread through contaminated food and water, and is widely spread throughout the world, as you can see by this map here. So you can see it's in Mexico and Greenland, all of South America, all of Africa, and most of Asia as well, because the dark green are the areas that are infected with hepatitis A. So those are the areas that you would want to think about getting hepatitis A vaccine if you were going to travel to one of those countries. And that is not a required vaccine. Again, required vaccines are vaccines that you have to get into the country, but it is a strongly recommended vaccine because of the risk of you contracting the disease while you're there. So you want to get that vaccine to protect yourself. Now, how is hepatitis A transmitted? Like I said, it's spread through contaminated food and water, but it also can be spread from person to person. So if you come in contact with someone who has hepatitis A and they are preparing your food and they can spread it that way. You can also spread it through other close contact from person to person. Now, what's the risk of hepatitis A? It's anywhere from 3 to 30 cases per 10,000 travelers. So it's not a huge risk, but it's definitely a risk that is worth avoiding. Now, the morbidity, which means the risk of illness increases with age, and the older you get, the more likely you are to get sick from it, and the more likely you are to die from it as well. Now, in some areas, because of better hygiene with food and water, the risk is declining, but in general, you want to be careful about the hepatitis A. Now, how do you prevent hepatitis A other than getting the vaccine? Obviously, you want to get the vaccine, but even if you get the vaccine, the number one thing you want to do to avoid getting hepatitis A is food and water precautions. And when I say food and water precautions, I mean stick to bottled water and don't eat anything raw unless it's something that you peel yourself. So no salads, no pre-peeled fruits, those kind of things, because those are the kind of things that can be contaminated with hepatitis A if they've been grown in soil that is contaminated or if they've been washed in water that's been contaminated. Now that's hepatitis A. Hepatitis B is another virus. They're related in the sense that they both can affect the liver, which is what hepatitis means, just an inflammation of the liver. But it is a different virus. So it has a different prevalence in the world. So this map here is the map that shows where hepatitis B is spread. So you can see it's a little bit different. It's not as prevalent in South America, it's not as prevalent in Mexico, but it's a lot more prevalent in northern Canada. It is still prevalent in Asia and Africa. Now, how is that spread? Because it's a different virus, it's spread differently. This one is spread through contact with blood and bodily fluids. So it can be spread through sexual contact. It can be spread through injections, dental work, any type of medical procedure. It can be spread from child to child. It can be spread from mother to child. So if a mother is infected, she can infect her unborn child. So bodily fluids and blood contact, that's how you get hepatitis B, which remember is different than hepatitis A because hepatitis A is spread through food and water primarily. So what's the risk for hepatitis B? Again, it's more behavior driven. Are you going to be having sexual contact with someone who potentially can be infected? Or are you going to be having blood transfusions or medical work or any type of contact with blood or bodily fluids? If you can mitigate your risk by changing your behavior, that greatly decreases your risk for hepatitis B. Obviously, if you are in a car accident and you need a blood transfusion or you need a medical procedure, you can't change that risk because you had no control over that. But you can control the other risks that can be associated with it. Now, what's the risk for that? It's anywhere from 1 to 2,000 per 10,000 travelers per month in an infected area. So again, it's a less of a risk because it is more behavior driven. So how do you prevent it? Obviously, you can get the hepatitis B vaccine, which is very effective against the hepatitis B virus. You can also use safer sexual practices. Use a condom. Don't have sex with people who are unknown to you in foreign countries or anywhere for that matter. You can also avoid exposures, tattoos, body piercings, any type of injections, especially intravenous drug use or any type of injections like that, especially if you're going to be sharing needles or they potentially are not clean needles like they would be if you had those procedures done here. You want to avoid blood transfusions if at all possible. You want to make sure you also get the immunization, as I said, and you want to go to areas, if you do need medical care, that you go to a hospital that is more likely to be safer and use clean instruments and things like that. Typhoid is another illness that is spread through contaminated food and water. It is a bacteria as opposed to a virus. Hepatitis A and hepatitis B are both viruses. Now this map here shows where typhoid is in the world, and as you can see, it is much more prevalent than either hepatitis A or hepatitis B. It's throughout the Caribbean, it's in Mexico, throughout South America, all of Eastern Europe, all of Africa. And you can see it's at highest risk in Southeast Asia, India, in that because the darker, kind of that bluish, grayish, blackish color is the highest prevalence, and the aqua is the rest of the medium risk. So you can see it's a pretty prevalent illness throughout the world. And as I said, it's spread through contaminated food and water. So in most places in the world, if you are at risk for typhoid, you're also at risk for hepatitis A because they're both spread through contaminated food and water. So who's at risk for getting typhoid? The risk is highest for people who are more off the usual tourist areas, who are in the smaller villages, smaller towns, not in the big resort areas, especially people who are visiting friends and relatives because they are going to be more likely to go and be with the local population as opposed to being in the in the resort areas. And as I said on the map, the highest risk is for travelers to the Indian subcontinent. How do you prevent it? Number one prevention is the vaccine, but also another form of prevention is food and water precautions, just like we talked about with hepatitis A. So it's bottled water, it's no raw food unless you peel it, those type things, and make sure that your food is cooked all the way through. This is not the time when you're traveling to have that medium rare steak. You really want to make sure that everything is cooked all the way through and hot all the way through, because that's what kills those bacteria. The polio. Now in this country, polio is pretty much a disease that doesn't exist anymore, and that is due to the widespread use of the vaccines. But however, there are still certain countries, especially in Africa, some parts of Asia, where there's still polio in the population. So if you go to those areas, you do still want to get vaccinated against polio, because even if you got the vaccine for polio as a child, which most people in America did, you do still want to get another polio vaccine as a booster if you're going to an area where you're going to be exposed to that polio virus. Now, most industrialized countries use an activated polio, which is an injection polio, but in a lot of the countries that are still affected with polio, they still use the old drops like we used to use, whether we put the drops on the sugar cube. So they both work, but the vaccine is more effective than the oral polio, which is why we stopped using the oral polio vaccine in this country. And this map is about meningitis. Now, meningitis you probably heard about, because every now and then there are outbreaks in college campuses, and most college kids, if they're going to live in a dorm, they have to get a vaccine against meningitis for that reason. But there is still plenty of places in the world where you are at risk for meningitis, and that's what this map is. That red band across Africa is the part of the world where the risk of meningitis is the highest, especially during their dry season, which is December through June. So anybody who's going through that part of the world, especially at that time of year, should definitely think about getting a meningitis vaccine, especially the more contact you have with the local population. So again, if you're going for a business meeting and you're going to be meeting with mostly people from Western Europe and America, you're at less of a risk than if you're going to be spending a lot of time with the local population. So how do you get meningitis? It's a respiratory transmission, so it's spread kind of like the flu or a cold. So if someone has it, they're coughing, the bacteria gets in the air, you breathe it in, and that's how you get it. And that's why it's especially prevalent in crowded areas, which is why in dorms and nursing homes and other places where people are really crowded together, that's why you're at a higher risk in that situation. And that's why in Saudi Arabia, when you go for the religious pilgrimage called the Hajj, which is an annual thing where millions of people from around the world come together and they're all in one place at one time, that's why they require that you get that vaccine to protect yourself against that, because you're going to be in such a crowded position. Now, the next thing I want to talk about is a disease called Japanese encephalitis, and that is primarily in Southeast Asia, as this map shows. And it's usually in more of the more remote areas, the more jungle areas, the smaller villages, smaller towns, less at risk in the resort areas or the larger cities. And so how do you get Japanese encephalitis? This is one that's spread through mosquito bites. And so it's a mosquito that typically bites in the evening, so dusk or dawn. And the longer you're there, the higher your risk. So if you're going to Tokyo for a week, you're much less likely to be at risk than if you were going to be doing missionary work in the jungles of another country that's less a more remote area, and you're going to be there for 6 months to a year. So I always recommend that people who are going to be, especially in remote areas, especially for a longer period of time, they should think about getting the Japanese encephalitis vaccine, because Japanese encephalitis is a disease that can be fatal. Rabies is another thing that you want to think about when you're traveling overseas. And most people know, but how do you get rabies? You get it from an animal bite. You can get it also from a scratch, which is one thing that people don't realize that you can get it. Most common is from dogs, but you can also get it from monkeys or bats. So I always tell people who are going to be really in a remote area or people who have a lot of exposure to animals, that they should think about getting a rabies vaccine before they go. Again, if you're going to be in a remote area where it's going to take you 2 or 3 days to get in for medical care, you definitely want to get that vaccine ahead of time. But even if you get the vaccine ahead of time, if you are bitten by an animal, you will still need to get more vaccines after you're bitten. The pre-bite vaccines just buy you enough time to get to where you need to go to get those other vaccines. But it's, again, people who have a lot of exposure to animals, people who are going to be in areas for a long time, because they're much more likely to be at risk for animal bites the longer you are in an area where you're going to be exposed, or you're just more likely to run into an animal. But the number one thing to prevent rabies is to avoid animal bites. And so how do you do that? You just stay away from the animals. You don't pet the dog that's walking through the street. You don't feed the monkey at the temple where you're going, because even if that animal looks normal and healthy, they could still have rabies and just not be showing any symptoms yet. Now we're going to talk about malaria. Malaria is also very, very common, and it's spread through mosquito bites as well. That's our little friend here, the mosquito that spreads malaria. Now, you're at risk for malaria in over 100 countries, 500 million cases a year, with 3 million people who die from malaria annually. Most cases of people who die from malaria are people who are living in those countries where they're infected. In most cases of this particular type of malaria, which is called falciparum, which is the most deadly type of malaria, most of that occurs in Africa, but you can get malaria in other parts of the world, not just Africa. And the highest risk is for people who are traveling and visiting friends and relatives, again, because they tend to be in country longer and they tend to be in less populated areas. And this is the map that shows where malaria is in the world. So again, you see most of it is in Africa, but in plenty of places in Asia, as well as Central and South America as well. So you want to think about the ABCDs of malaria. You want to be aware of your risk. You want to avoid getting bitten by those mosquitoes. You want to take chemoprophylaxis, which is medicine. And if you do get a fever, even up to a year after you've been in a malaria infected area, you want to let your doctor know, hey, I was in this country 6 months ago and now I have a fever, so you want to be sure you check me for malaria, because malaria can appear up to a year after the time of the insect bite. So the way you want to avoid getting bitten is you want to use insect repellent. You definitely want to use one with DEET. This is the time for the good chemical stuff. This is not the time for the plant-based, because you really want the strongest protection. You want to use protective clothing. You can even use a medicine called permethrin, which is you use to treat your clothing. It's an insect repellent for clothing, so that way you won't get bitten through the clothing. You want to sleep in air conditioning, or if you can't sleep in air conditioning, you want to use a mosquito net over your bed so that you are protected against mosquito bites overnight. And you want to stay away from being outside as much as possible at night, because the mosquito that spreads malaria is one that bites at night. Last thing I want to talk to you about is traveler's diarrhea. 20 to 60% of travelers who go to an area where there's risk of traveler's diarrhea will get traveler's diarrhea. 25% of them will be sick enough to where they have to alter their itinerary. 15% are sick enough where they have to stay in bed, and 3% have long-term problems. It can be caused by bacteria, it can be caused by virus, or it can be caused by parasites. You can see the different causes there, and they all have different treatments. The number one thing you want to think about when protecting yourself against traveler's diarrhea: boil it, cook it, peel it, or forget it. It's easy to remember. The slide says it's impossible to do. It's not impossible, it's just very difficult, but you just have to be focused all the time, because the number one thing that people forget about, they forget about water, they forget about ice cubes, and then they just take a bite of an apple or something like that. So you always want to make sure that anything you eat is cooked all the way through, hot all the way through, and anything you eat that's raw, you want to peel it yourself. And then you also want to think about safety, security, and other things, but that's always a topic for another day, of course. But because I don't want to overwhelm you. The main thing I want to talk to you today about was about the illnesses that you want to talk to your travel medicine physician as far as getting those vaccines done, and that's what you want to do. You want to make sure that you go to that physician at least several weeks ahead of time, because some of the vaccines you need to get a series for, so you don't want to wait until you're leaving 3 days from now and say, hey, I want to get my vaccines. You always want to start at least a month ahead of time. Kind of as soon as you know your itinerary, you want to start thinking about getting those vaccines and talking to your physician about maybe taking medicine for malaria, or ask them about if they want to put you on medicine or give you a prescription for an antibiotic to take with you so that you have something if you do get traveler's diarrhea. But the main things you want to think about are protecting yourself, because you don't want to think about just the required vaccines, because the required vaccines are more about protecting the country that you're going to, but you want to think about protecting yourself, and that's what you want to pay attention to. So I hope this has not deterred you from international travel, because it's still fabulous, but you just have to be paying attention and staying healthy. I'm Dr. Alancia Wynn, and this has been Health Chat. I will see you next time.